Mental health reform in Trinidad and Tobago critically. Ignoring has severe implication for crime, school violence, public well-being. This minute a devastating problem in the country, made dire a variety of factors, amongst our poverty and crime. Defined mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. 1. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Read in description or closed captions. Mental health care policy summary. 1. Mental health reform interpreted as effort shall be made to address mental health, inclusive an investigation of St. Anne's Hospital, and a board of experts to recommend reform with the whole country in mind, inclusive of prison, police, Coast Guard, Army, schools, vagrancy and general public. 2. Mental health boards staffed by experts are charged by the administration to make recommendations. 3. Mental health ambulance taking Sweden's page, take calls from the suicidal and severe mental illness individuals and decide if hospitalization needed. A psychiatric emergency response unit. 4. Children and adolescents receive a special emphasis. 5. School violence. The ministry plays a big part in reducing in part with counseling. Enough experts are integrated in schools. For instance, school counselor availability greatly increased. 6. Ministry of Mental Health and Loneliness taking a page from Japan, Canada, UK, a cabinet post whereby the minister working very closely with experts addresses such matters, utilizing a range of therapy and support. All state-employed experts under its remit, social workers, school counselors, psychiatrists and psychologists placed under it. 7. Line minister in the Ministry of Mental Health and Loneliness. This individual must have the relevant expertise. 8. Ministry of Mental Health missions include and not limited to assessing cadets and graduates of security services, prison, police, Coast Guard, Defense Force and Fire Department, servicing school children and parents, hospitals and clinics and services free of charge general to the public by way of offices. Repeating all state-hired social workers, school counselors, psychiatrists and psychologists placed under it. 9. First world state and high-tech state. Trinidad's road to such would greatly relieve desperation and depression. 10. Psychiatric Research Institute, a facility set up to examine mental health. Part of a healthcare industry. 11. Imported mental health experts, a way to address a shortage of experts and pay due care to local mental health. Trinidad and Tobago will hire psychologists, psychiatrists, mental health nurse practitioners, psychiatric mental health nurse practitioners and counselors from worldwide to serve local school, police, prisons, health facilities and public. Benefits given include free bus and ferry pass, respectable salary, no utility bill, bonuses for outstanding work, free housing, access to the universal health system, paid vacation, free flight to and from Trinidad and Tobago, orientation, where MH experts will be exposed to various activities related to mental health in Trinidad, lodging and meals of orientation are free. 12. Free private psychologists and psychiatrist services. The state subsidizes private practitioners in whole for the public. Enhances access to treatment. 13. Mental health treatment and permission. By law the state can administer treatment to persons judged in need without their guardian or family consent. They, guardians or family, may not sue the state without cause. 14. Address officer. Wellness officers in police, army, fire department, Coast Guard receive mandatory mental health counseling on a quarterly basis. The mental health ministry responsible. 15. Prison psychologists assess all new inmates and devise personalized prison plans. Recommendations for classes, counseling, vocational training and work. Inmates who follow the plan earn greater freedom and early release. The experts hired in adequate numbers. 16. Mental health of inmates in jail and administration must do an assessment to ascertain what required. 17. Rehab centers can accommodate a variety of problems including alcoholism, drugs, occupational and violence. Constructed in both islands. The mental health ministry shall participate. 18. State of the family. Family is one main cause of crime, alongside poverty and mental health. Government must conduct measures to address problems therein that in turn hobble society. The approach centers on social aid and elevating to a middle-class living standard, for instance an assigned counselor, poverty alleviation, affordable housing, subsidized education, depending on circumstance.